Okay, now a lot of what we have on the board has to do with EPS and medications for this patient. So if you look at the handout and you turn to those medications, it is thebomb.com. You got 2 in your handouts, and they are all equally important. If you look in the white packet, I want you to turn to those meds, and there's a list. It's usually like right after suicide or whatever. And you'll see it looks like this. Very important. Okay? These, what I want you to write at the top of this handout, I want you to write this. EPS or extrapyramidal symptoms, and you need to make sure you know it's caused by antipsychotics. EPS or extrapyramidal symptoms are caused by EPS. I mean by antipsychotics. Right. Slap me, baby. Slap me, darling. I sound like the patient. Okay. So EPS or extrapyramidal symptoms, they're caused by antipsychotics. Now, of course, you little sweethearts, if you turn in your pink packet, because we're going to use both of these together, you'll see a handout similar to this, and it's on the second page. If you turn, maybe the third, I don't know. Oh, fifth. Shows how much I know. Okay, so it should be after Haldol and, yeah, there it is. Okay. So it's a handout that looks a little bit like this. Now, here's what we're telling you. Everything on that handout causes everything on this handout. Okay, so again, everything on the pink handout causes everything on this white handout. And of course, all you need to do on your pink handout at the top is put causes EPS. These meds cause EPS. Because we're going to talk about EPS, and then we're going to extrapolate something even more dangerous, which is neuroleptic malignant syndrome, and it is all related to our schizophrenic guy. So you got to keep them 3 together. Schizophrenia, neuroleptic malignant syndrome, EPS, antipsychotics, da-da-da-da. Okay. Let's talk about our EPS first. First of all, every single patient on an antipsychotic is going to have some of that. It's a guarantee. So on this packet, everybody is going to have a little bit of this. Every patient's going to have a little bit of EPS. Every single patient being treated is going to have a little bit of EPS.
So these medications are here cause symptoms down here.
Yep. Okay. And you can't manage schizophrenia without those meds. And every single schizophrenic patient is going to have some of this. Now, what you have to remember, beloved, in the real world is, yes, 100% of schizophrenic patients will have some of these. But we also use the same kind of drugs occasionally to treat bipolar. So occasionally, your bipolar patient will have some of these as well. It's because of these symptoms that you should never do what all of your friends are doing, which is giving elderly patients without a psychiatric history the same meds we use for schizophrenia. You should not be giving the elderly demented patient Haldol. You should not be giving the elderly patient a Hitothorazine. What? This is why you don't do that, because everybody gets these, and these in the elderly are life-threatening. So let's start with the very first one. On the board is something that's not first on your sheet. So if you look at the first one on my board, I put it there for a reason. Couldn't quite find a handout that put it there for a reason. So I need you to fix things up a little bit. For this one, you're going to write OMG. And on here, it's second, so you're going to put OMG, which is what I wrote on mine. I literally put that. You had to know that your dystonic reactions was a medical emergency. It is the very first one to appear, and it is who you better see first, and it is who you better stop the medication on. So this particular EPS symptom is one that we cannot allow, because dystonic reactions can give the patient symptoms that will cause them to aspirate and die. So let's look at it. So one thing you got there, you should say, OMG, stop the drug ASAP, see them first, and then they need a med alert bracelet, med alert, and allergy, because they're supposed to tell everybody from now on they're allergic to that drug. Now, when you look at this, it makes sense. Oh my God, it makes sense. So look at it. It's talking about dystonic reactions are what? Involuntary. Muscle contractions of the who? Head, neck, trunk, and what? Neck and head alone should have made you go, That's airway. So the neck and head muscles are the most commonly affected areas, including the who? Tongue, throat. Oh, hell no. So symptoms affecting the tongue and throat muscles can affect the vocal cords, causing a hoarse voice and a stiff or thick tongue. Here we go. Dysphagia, laryngeal, pharyngeal spasms. Potential obstruction, medical emergency. Yeah. If you go a little bit further, I need you to highlight something else, because when you see it, you're going to be like, oh, I've seen that before. Let's see if you get which patient it's in. It says, in addition, clients may experience, what's it say? Oculogyric crisis, which is rolling of the eyes in a locked upward position. Who did that? What other patient does that? Parkinson's. Parkinson's. Put it on the side margin so you remember it on your test. Parkinson's patients have an oculogyric crisis. And I don't know if you've been paying attention to your oh my God sheet, but I wrote on your oh my God sheet, any crisis is who you see first. Okay? Okay, so the real deal Holyfield is this is the only, get this is the only dystonic reaction we cannot allow to continue. Everything else? Okay. Now, the important thing to remember about dystonic reactions, they can occur within seconds of administering the drug. No, because I ain't finna let it stay in my patient that long.
So, if the patient goes to an outpatient clinic and gets prescribed these medicines, who is there to oversee it or directly observe? Well, number one, you didn't become an outpatient. You were an inpatient before. You were an outpatient because all of these patients had a breakdown, at which point during their inpatient stay we gave them the number one antipsychotic, which is Haldol. And so once they did this crazy stuff, we was like, okay, not a good drug for them. So it's usually inpatient that they're first introduced to any of this. It's not like, oh, I think I'll go to my doctor and tell him I've been doing funky shit. No, you were probably arrested or hospitalized some other kind of way. Maybe family brought you in. So you got introduced that way. And now you're an outpatient, you may have to wear a medic alert because you'll never get that drug again. It will kill you. Okay. So dystonic, look what I did now, everybody. I crossed that one off. You can't deal with that. All the rest of the three patients have it all the time. So let's look at our three.
You just keep giving them the meds even if they cancel?
They have this? No, you stop the drug.
No, I'm talking about the other thing. Because I had a patient who was having these symptoms, and I went and told the nurse, and she was like, oh yeah, it's EPS, it's fine, and she gave him another dose of Haldol. I was like,
what symptom were they having,
they
baby?
were like shaking.
Oh yeah, that's normal.
Stooped over.
Totally normal.
And I was like,
totally normal. This is why you don't give it to elderly. You can see now.
He was
Well, I mean, but he had a psychiatric history.
Yeah.
Hopefully.
Yeah.
Look, hopefully. You never know.
But I don't
Oh, he was in neuropsych?
Geropsych.
Oh, geropsych. Well, then. Yeah, they do. Yeah, so, but this is different. You can't swallow.
Right.
Yeah. So you got spasms. I mean, it's so weird. You'd know it right off the grip. But all the rest, we about to explain that one.
Yeah, I was horrified. I was like, oh my God.
I
Keep
know.
giving it to him?
Oh yeah, over and over again. But look, it's so sad when you even hear these. This is why the patient doesn't want to take their drugs. That's why they stop.
I don't want to take that.
No, and they're not that crazy not to notice this. Okay? So here we go. Let's look at the next one, akathisia. Putting the top, you know how you have the word there, put next to the word itself, motor restlessness. Next to the word, some of y'all writing in a notebook. I'm telling you how to get past this test. Baby, go ahead and put it near the word, motor restlessness. Now, look what it says in the first sentence. What does it say? One of the most common EPS is akathisia. It says that the patient has motor restlessness. That's in the first sentence. If you go a little bit further, it says the patient may even tell you they can't remain calm. Their sleep is disturbed. It seems like they have anxiety. Y'all see that? Okay. Then it says the client, when you look at them, and this is going back to what you said, baby girl, it says when you look at them, or objectively, clients may demonstrate restlessness through actions such as pacing, marching, shuffling, foot tapping, rocking motion, shifting weight, leg to leg, yada, yada, yada. They can't be still. That's what you got to remember on this test. They cannot be still. That's why you don't get worked up into a sweat when your patient is pacing. That's normal. They pace, they march, they do this all day. They just shift from foot to foot. They tap, 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 tap. They can't be still. Okay? So that's part of the damn drug. All right, now at the bottom, it says pseudoparkinsonism is the same thing as Parkinson's. So in this patient, you have pill rolling. There's your tremors, baby. You have the tremors, blank facial expression, like mask-like, voice weak. They don't swing their arms anymore. What did you say to me a minute ago? Stooped posture. That's what the baby said. Impaired shuffling gait, rigidity. You imagine? You ain't gonna want to take this drug. You are not gonna want to take this drug if that's what it's doing to you. And these patients are with it most of the time because here's what you got to remember. When they're on the med, they're not hallucinating as much. They're not doing any delusions. Usually they knock that right out. This person may be a little more paranoid than most, maybe even a little bit more conspiratorial than most, but they're living their life. They're playing basketball, trying to anyway. They're trying to drive their car, but then you have this stiffness going on. They're trying to do life, and you got this crap going on. No wonder they stopped the med. So this is the number one problem. This is why they get hospitalized because of this stuff. They don't want the meds. I don't want them either. Okay? So that's your pseudoparkinsonism. If you turn the page, the last one on here is very common, but it is the last to appear. You need to write what I wrote, even though it's not written on your sheet. If you look at your sheet, it says dyskinesia. Everybody see that? Look what I wrote. You're going to write it the way I wrote it. Tardive dyskinesia. I don't know where Lou at, but this would have been the time to catch it. Tardive dyskinesia. Look what I got. Tardy. Tardy means late. Don't be tardy for the party, girl. Tardy means late. And that means the last to appear. Don't be tardy for the party. Who is that in Housewives? Who's that? Kim, crazy ass. Okay, so don't be tardy to the party, honey. Tardive dyskinesia is the last symptom to appear. You've been on the drug for years, and now all of a sudden it's appearing. You never had anything before. Now all of a sudden it's appearing. Now what is it that's appearing? Well, here we go. Rapid, repetitive, involuntary movements. So you doing this. All that. It's all in here. Grimacing, hissing, kissing, sucking, ticking. All of it's in there. That's what they're doing. Lou, get this. Tardy. Tardy for the party. This symptom is going to be the last one to occur years later. But it's not a reason to stop the drug, is it, y'all? Remember I said ain't but one reason to stop the drug is dystonia. This one is not, but you can see where it makes you look crazier, right? So the patient hates this. And look what it says. It says sucking and kissing and frowning and grimacing and smacking and rolling and protruding the tongue and pulling it back. I mean, come on now. This is stupid. This is crazy. Nobody wants to look like that. And the body, it may rock or twist. Like I know the people I know with this kind of stuff, I know a lot of people with this. They do this. They just do this the whole time. It's from the drug. Okay? Sometimes they do kind of like this twisted motion. The trunk is twisted. It's just ridiculous. And they feel and they know that they look different and crazy to other people. They know that, so they don't like it. Okay? Now, I want you to add some things in this box. You see your box? You got to highlight diabetes. The diabetic has these worst of all. If the diabetic is a schizophrenic patient, they're the ones that are going to have this worse than anybody else. African Americans have it worse than anybody else. And it can also be caused by two other drugs. Make sure you write them. Reglan and Compazine. So tardive dyskinesia, that particular EPS symptom can also be caused by Reglan and Compazine. Okay? Now, here's our problem, and that's why I got a lot of space on the page. You've got to use the rest of this page for this one. Neuroleptic Malignant Syndrome. You've got to use the rest of the page for that. When it comes to EPS and the schizophrenic patient, I want you to know, even though EPS is common, neuroleptic malignant syndrome is rare. You better know that. This is rare, but deadly. Rare, but deadly. Now, I want to see where my baby's at today. I want to see if y'all got a clue today. You had a long day. Stay with your girl. The word malignant means what, everyone? Deadly. Okay, that's good. Y'all jamming. Now, let's come on over here, because I'm trying to see where my baby's at. Uh-oh. Uh-oh. What do you automatically know when you see the word neuro? Good job. They have a headache. What else? High blood pressure. What else? Come on. Oh, shit. There they go. There go the baby. You better know all of this. What kind of reflexes you think they got? Oh, okay, there they go. Okay, cool. Now, I swear to God, you may know nothing about this, but already you probably would have got this right in the sense that you realize I'm teaching about it in a psych lecture. It's deadly. They have a headache. They're at risk for seizures. Their blood pressure's high. Boom. You ain't know shit about this damn disease. You just had to remember the words don't lie. The word malignant, it means deadly no matter where I put that word. That's why malignant hyperthermia, deadly. Now, let's give it some backdrop, though. Let's give it some backdrop. This is a schizophrenic patient. This is a schizophrenic patient. It's a medication complication caused by antipsychotics. So this is a schizophrenic patient. It is a medication complication caused by antipsychotics. And this patient is usually homeless. This patient is usually homeless. It's summertime. It's summertime. That's important. So So these medications in hot sunlight and summer weather can cause neuroleptic malignant syndrome, especially in the homeless patient who tends to get dehydrated in that weather. So patients usually dehydrated, hot, homeless, and if you don't know anything about the homeless, you should, because as a nurse you should be very compassionate. And what you may or may not know about the homeless is that most of them are veterans, and most of those are schizophrenic. They went over across some damn place and fought for us and came back crazy, and there's no doubt why, because they've been exposed to crazy. So you have to be compassionate for the homeless, because again, they're usually veterans. Mm-hmm.
It's so hard to tell nowadays because everybody is just out there begging, and they all
Well, now, being compassionate and giving them your purse is two different things, not child. But my point is that when they come into your hospital, you have to still be loving. Yeah, you have to be loving. You like, give them all your money. No. But you're going to love on them, huh? You're never going to ever judge. So, for the grace of God could be me. So you want to make sure you know this person's homeless, they're coming in like this shit. Now, what else are they going to have? Oh, my God. Your blood pressure's real high. The headache is real severe. But the way you going to know it on the test, oh, my God, it's so easy. It's the only psych patient with a fever. What kind of fever, Shelly? 106. It's high as hell. This is the only psych patient on the whole test with a fever. And you already know what's up. When they start talking about patient on Haldol with a temperature of 106, bam, done with that. Keep it moving to the next test question, because I already know this one. I know the select all and everything. Okay, that's how you got to look at it. Now, they got this fever, they got this high blood. Oh, by the way, this is ridiculous. This is really high. Their head is hurting as a result. They're at risk for seizures. But they got one more symptom that's weird. Who can tell me what it is? Muscle rigidity. Their jaw is clenched. Their neck is stiff. Their body's contorted. They are so stiff, muscular-wise. Muscle rigidity. Everything's contracted. Unfortunately, that's not going to be good. That muscle rigidity, yes, can lead them right down the slippery slope to rhabdomyolysis. Rhabdomyolysis. Okay, now, so we got a patient who's homeless, schizophrenic, on an antipsychotic, probably Haldol or Prolixin, summertime, short sleeves, sun exposure, dehydrated, headache, blood pressure, seizures, brisk reflexes, muscle rigidity. Your first nursing action is to hydrate the patient. Yup, got to give them some water, lots of it in an IV. Hydrate the patient with plenty of fluids. First nursing action. Then you have to give them an anticholinergic to save their life. An anticholinergic to save their life. Name one. Cogentin or benztropine is on the front page of your pink packet. Turn to that. Make sure you have that out while we're talking. Cogentin, which is benztropine. And I want to say something else to you, too, about this patient. This patient, if they brought in by their family is going to say their EPS symptoms were getting worse. So the family might say, we was in here 2 weeks ago. I told you he was having some problem. Y'all didn't keep him. Now look at him. And you look in the chart and it shows where the EPS symptoms were even worse. So this patient has had a progression of the EPS complaints And now we're sitting up here with neuroleptic malignant syndrome. Okay, so this patient needs an anticholinergic. What's so weird about this patient, they may have already taken that every day, like they're supposed to with their meds. It may not be strong enough, so you got to know all the other anticholinergics. What other kind of anticholinergics we need?
Symmetril.
Oh, good job. Symmetril. What's the other name for Symmetril? Amantadine. Excellent. Give me another one. Bromocriptine. Very good. Bromocriptine, which is Parladel. No, but believe it or not, a drug that can do the similar thing as these is actually Benadryl. So make sure you're writing all these on a pink sheet. That front page with the cogen, write these on that pink sheet. Benadryl is also called what? Diphenhydramine. Yep. Okay, now listen, babies. You got your Cogentin, your Symmetril, your Bromocriptine, you got your Benadryl. All of these drugs will help this patient. And they need to be written on top of the benztropine page as anticholinergics that could help the patient. The only thing that's not an anticholinergic is Benadryl. That's obviously an antihistamine, but the shit works. That's what you better know. It works. Now, the problem, let's just play it all the way out. Let's say you hydrated the patient, you gave an anticholinergic, we still ain't doing too good. We're not doing too good. You care about that because this patient with this rigid muscle rigidity going into rhabdomyolysis, we rather not see you over here. So we may have to give you, with this muscle rigidity, dantrolene. This is a potent muscle relaxer. And it's going to keep you from having a seriously contracted muscle the whole time, going into some daggone rhabdomyolysis. Because the cure for rhabdomyolysis sometimes is dialysis. Rhabdomyolysis gets dialysis. If you hydrated them and gave them a muscle relaxer, it didn't work. Ultimately, I'm going to have to do dialysis. If it didn't work now, I'm saying if all this shit didn't work and you continue to act crazy, I'm going to have to do dialysis. This is very deadly. You can see why. Shit is crazy. Okay, so there you go.